walla walla bing bang.
Ford couldn't even afford to go and seek medical opinion and advice, let alone treatment. And people suffered hugely as a result of that, and people died because of it. For me, there is no question the NHS is the jewel in the crown of a civilised society.
Uncertain, coy, and hard to please, when pain and anguish wring the brow, a ministering angel thou. Yes, a ministering angel, though they call her a ward orderly. The Minister of Food, for instance, and all her cooks and assistants. The ministers who sew, do the laundry, keep the hospitals spick and span. All of them helping those who most need help, the sick.
Our hospitals need 10,000 more women to do domestic work. Fighting sickness without them is fighting with one arm tied behind our backs. If you think you would like the work, be an angel and come and help.
Our nurses are busy and overworked because there aren't enough of them. Many hospitals have closed wards because of that. Who will help? You will? Good. But you can't like that, you know. First, you must learn nursing. It isn't difficult. While you're learning, you're paid. The job is interesting and there's plenty of companionship. 1 day off a week and 4 weeks paid holiday a year. And the most satisfying job of all, healing. There are 30,000 needed.
On the 5th of July 1948, healthcare provision in the UK was nationalised.
On July 5th, the new National Health Service starts.
As a doctor, it's appalling to me that your care should depend on how much money you've got to spend on it.
They are the days before the NHS.
We were short of everything.
When donations of blood were poured and stored in glass bottles, when patients' pets were brought to their bedside to aid recovery, and when even the training mannequins sported the facial fashions of the 40s.
Bandages were washed and re-rolled.
The idea was to bring together everyone involved in healthcare provision that would provide care that was free at the point of delivery. The National Health Service Act of 1946 created the NHS in England and Wales.
It took a little bit of persuasion, of course, to persuade people that they can now go and see the doctor. For example, there were terrible teeth. It was unusual to see a young person with a full set of teeth among the lower classes, inverted commas. The changes have been the disappearance of some diseases which were common. 1, polio. 2, the disappearance of a lot of the old surgery that I did, and the appearance of the surgery for today, which amazes me.
The NHS didn't appear without opposition, however.
The people who had money, and they tended to be the upper class and the middle class people, they didn't have to worry too much about being ill because they knew that they could always afford to pay for doctors or hospitals. But if you were a working class person, it was very different, and your expectations generally were quite low.
Families were very poorly off because they used to save up for the doctor to come. There is no doubt about that. Money was put on the shelf in the kitchen just in case the doctor had to be called.
The new Labour Prime Minister, Clement Attlee, and his government had established the NHS in the face of considerable opposition. Many of the doctors who were treating them were less enthusiastic.
They thought that they wouldn't get paid as much money because all of their patients were private and they could pretty much charge what they liked. So that was something that they didn't want to lose.
Yeah.
And what the NHS said to them, we'll let you keep your private patients and you can treat them in NHS hospitals.
Right.
And we'll just give you some salary, but we won't stop you treating private patients. So they actually did very well out of it. And what Aneurin Bevan said, the Minister of Health at the time, he said he was going to choke their mouths with gold in order for them to agree to the National Health Service.